Hi friends, I'm Dr. Sunil Richardson. I'm a maxillofacial and craniofacial surgeon. I practice out of Richardsons Craniofacial Hospital at Nagercoil in South India, mainly. I also work out of Muscat in the Middle East, or I used to, at least till the pandemic. Now today, I'm going to talk to you about a small aspect of rhinoplasty. A question that a lot of our subscribers keep asking me is, does rhinoplasty help in breathing? A one-word answer to this question is a big yes. But to explain it a little bit more, I want to tell you first about the middle part of the nose or the septum, which constitutes like the divider. So septum very often gets deviated in a lot of patients, in a good percentage of patients, but doesn't cause a problem. But it also causes a problem in a small percentage of patients, and that could be obstruction. So whenever I do a rhinoplasty, I mandatorily take a cone beam CT scan. I look at the architecture of the nasal bones and the septum. This is a must that I do. And because of that, any deviation in the septum, I absolutely always address. So that answers your first question. But is septum the only reason for difficulty in breathing? The answer is no. It depends on the bones on the side, the vault, depends on the turbinates, whether you have hypertrophy. It also depends on something called as an internal valve. Now to address the internal valve, which a lot of surgeons don't address, I tend to use the auto spreader flaps. These auto spreader flaps are just awesome. They basically improve the breathing ability of the nose, especially after you do a reduction rhinoplasty or especially after you do an osteotomy. And along with this, we also use lots of grafts which are made to ensure good breathing. As far as aesthetic goes, even though rhinoplasty is a cosmetic surgery, I would like to think that it's also a very, very important functional surgery. And function, in my view, always takes a higher precedence than aesthetics. So when you're looking at an aesthetic surgery, at no point in time, we're going to compromise your function. If at all there's anything, we're going to improve that function, and that is the function of breathing. So I hope you get the message that when you choose rhinoplasty with us, you definitely know that if there's an issue with your septum or your internal nasal valve or the vault, we're going to obviously take care of that. When there is a severe septum and we obviously have to do major work on the septum, I tend to call those surgeries as septorhinoplasty. But definitely every rhinoplasty, we look at the septum. I look at the septum. Now we're also going to talk about reconstructive rhinoplasty surgeries, major surgeries. In those surgeries also, again, no question about the fact that we look at the septum and we look at the functional aspect, which is really the most important aspect before you consider rhinoplasty. Even though the common man or a common person thinks of rhinoplasty as a cosmetic plastic surgical procedure or as a procedure to reshape or recontour the nose, something that doesn't get said very often is the fact that we always take care of breathing or the functional aspects along with it. So this is a model I'm having. Of course, this patient didn't get the model done for rhinoplasty, but I'm going to use this model to try and drive home the point of the importance of taking a cone beam or a CT scan before we do a rhinoplasty. We definitely get to study the entire nasal aspect as clearly as possible. And this is made, I'm going to just show you what I'm trying to say. Now, this is the part that I've removed, but literally this is the nose now when we're talking about the rhinoplasty. This is the bone on the side, which is the nasal bone, and center is a septum. The septum is not complete here now, but you can see there's a small ledge coming from there, which my fingers are there now, so that's a septum. So this bone actually runs through and through down all the way and divides the nasal cavity into two. But that's in an ideal situation. You could have it that this moves to one side and then you have what is called as a deviated nasal septum. So definitely when we're looking at the recontouring or restructuring the nasal framework as what we do in rhinoplasty, we have to take care of the nose or the nasal bones. We have to take care of the septum, cartilage on top, the upper lateral cartilage, lower lateral cartilage, septal cartilage, and also the skin and vestibule. Skin is the part on top and vestibule is the part inside the nose. So all of these structures are very finely related to one another, and they also at the very end give the patient a good functional outcome. So we have to really make sure that when we are narrowing the bone here, you got to give some space right at the top of the nose, which we call as the internal wall, so that the reduction in width here gets compensated by the additional width there for the patient to breathe. So the take-home message is that absolutely all our patients who undergo rhinoplasty definitely get a thorough examination of their septum and the whole nasal cavity, so that there's any issue that is there will get addressed at the same time. And so therefore rhinoplasty also equals improved breathing. Thank you.